Hey, are you treating your rheumatoid arthritis but still having trouble with everyday things? Could Orencia help you? Talk to your doctor. I did. Listen for details about the Orencia Promise Program and this free copay card.
Can you open this? Fasten this? Oh, yes, I can. Orencia. It's an RA treatment that's proven to make a difference for many patients, including those who weren't helped enough by other treatments, relieving the symptoms of RA and controlling the advance of joint damage.
Do not take Orencia with another biologic medicine for RA due to an increased risk of serious infection. Orencia can cause serious side effects, including serious infections. Certain cancers have been reported. Tell your doctor if you are prone to or have any infection like an open sore or the flu. If you have a history of COPD, a chronic lung disease, Orencia may worsen your COPD.
Thousands of RA patients have experienced Orencia. What about you? Go to Orencia.com or call 1-800-ORENCIA for more about Orencia and the Promise Program for new Orencia patients covered by private insurance. We'll pay your Orencia copay for 6 months. If you're not satisfied after 6 months, we'll pay your first copay of another RA medicine. Go online for the Orencia Promise Program. Talk to your rheumatologist. See if you can say, oh, yes, I can.
For nearly 2 million Americans, rheumatoid arthritis is a fact of life. It most often strikes women between the ages of 20 and 50 with crippling results. But new drugs are battling RA from a different angle, not only providing relief, but the hope of remission.
From the top of my neck to every toe in my foot, hot, pink, nasty feeling joints. It was kind of like being a Tin Man.
These sound like words of an 80-year-old.
I was 29 and 30. I had been ill for about 11 months.
But Lori Pucci-Ray is a young woman describing symptoms of a disease that made her feel old before her time.
I was at the point where I thought I really was never going to get better.
Lori was weighed down by RA, or rheumatoid arthritis.
Rheumatoid arthritis is a process where the immune system, for unclear reasons, goes awry.
It starts with swelling of the joint lining, and as it progresses, that lining thickens. Inflamed cells release enzymes that can destroy bone and cartilage.
They didn't have medicines when I was young like they do now.
Until a few years ago, doctors may have only prescribed over-the-counter pain relievers or drugs like prednisone. Later drugs called disease-modifying anti-rheumatic drugs, or DMARDs, provided greater relief.
Most commonly used is methotrexate.
Then along came a class of biologic drugs called TNF inhibitors. Drugs like infliximab and etanercept not only relieve symptoms, but can provide longer periods of remission.
In general, we've seen a change in treatment strategies in the last decade to a more aggressive use of existing medications, combinations of therapies.
TNF inhibitors block specific hormones that aggravate the condition and are sometimes given with other drugs like methotrexate to stop further joint damage and pain.
My senior year in college, I was a cheerleader, and the homecoming game, I woke up that morning and I had a really sore, painful wrist.
Frances Johnson describes what happened to her 40 years ago, just like it was yesterday.
All of a sudden, I started getting pains here and here, here and here, and other places. And you have to realize that in the 1950s, the doctors didn't know about what we call juvenile arthritis.
Over the years, Frances tried treatment after treatment. 2 years ago, she began using a TNF inhibitor. And it struck the right note.
I'm very thankful that I haven't had any serious pain very much at all since taking that.
Depending on the medication, some can be administered at home.
The needle's in.
Okay.
Here it comes.
Okay.
Others must be given in a clinical setting.
I only wish they'd had this drug when I was like 20, and then I probably wouldn't be in this condition today.
There is another option, only for patients who have not been helped by other drugs. Abatacept was approved this year by the FDA.
It is a protein. It's designed to specifically inhibit one of the signals that's used to communicate within the immune system.
It's almost made my hands really normal. You know, now I can make a fist.
Some patients call them wonder drugs, but biologic agents increase the risk of infection, both minor and serious. So it's important to discuss options with your doctor.
I'm a success story. I absolutely feel like I am.
Once upon a time, Lori's outlook was not as positive.
Couldn't even make a peanut butter sandwich without getting somebody else to open the jar.
Lori has a newfound inner and outer strength. Strength, she says, came from making diet part of her rheumatoid arthritis treatment.
Including foods that lower inflammation, as well as getting rid of foods that trigger off inflammation.
Dr. Harris McElwain says some foods can reduce inflammation.
Pineapple, dark grapes, dark cherries, blueberries, broccoli.
While other foods can trigger it.
Like the sulfites or tomato sauce or wheat.
And diet alone can't do the trick.
Controlling your body weight, very importantly adding the exercises to strengthen the joints and make them more flexible, and then finding the proper medications.
Physical activity can be a challenge for people in pain, but therapists find those who take the plunge feel a huge difference.
People with rheumatoid arthritis have less joint swelling, actual measurable joint swelling, if they participate in aerobic exercise, walking or water or bicycling.
Lori, Barbara, and Francis all make exercise and perseverance part of their routine.
Whether it's work or play or sickness, attitude's all. And no matter what it is, you just keep on plugging along.
Early diagnosis of RA and aggressive treatment can limit joint damage, loss of movement, and the potential need for surgery.